the ear. Of course, it's hearing, but it is also responsible for equilibrium. So just maintaining the balance. So if you look at your ear, these are structure or fibroelastic structures that are on both sides of your head in the temporal bone, okay? And if you look at it, the folded part that we see is what we call the helix. And we have the earlobe or the lobule, where you pierce to put earrings, girls, and the ovaries. We have a depression in the ear, usually which is usually dry and right before you enter into the ear canal. We call that the concha. And then we also have between the concha and the helix, we have what we call the antihelix. Okay. And then on the antihelix, we have up above the antihelix, we have what we call the triangular fossa. From the triangular fossa, come to the concha. From the concha, you have the tragus. Okay. So there are some women who have pierced the tragus. It's like a lobule, but just right outside the ear canal. Okay. And why is this important? It's important when you have a patient in a clinical setup. They come in complaining of pus coming from the ears. When you touch this tragus here, it's very tender. This should tell you that there's presence of infection in the ear canal. Okay, so the most important things I want you to remember is that the outer ear is made up of what we call the whole thing here. We call it the auricle or the pinna. Okay, the auricle or the pinna has what we call the lobe, earlobe or the lobule. It also has the helix. And then part of the other parts which we mentioned, the antihelix, the concha, all those are important as well. But the most important one is the lobule, the helix, and the tragus. From here, we have what we call the external auditory meatus, which we'll go into later on. As you explore yourselves, when studying, try to touch your ears, you'll be able to identify which structures are which based on this diagram. So parts of the ear has what we call the outer part or the outer ear, the middle ear, and the inner ear. If you look at our pink diagram here, our outer ear consists of the pinna, which we just saw. Remember, we said our pinna has a lobe and the helix, and all those other parts like the tragus and the helix. It also has what we call the external auditory canal or the ear canal. This is our auricle, our pinna. It has this part here. We said the antihelix. This folded part here, we call it the helix. We have here our ear canal or external auditory canal, or the others they say external acoustic canal. Some literature says that the eardrum is also part of the outer canal. Well, to some extent, yes, because one portion of the eardrum is in the external ear canal, so it would fit to be an outer ear part. But most literature say that it's a middle ear, part of the middle ear. So our outer ear consists of the auricle as well as the ear canal. So
sorry,
the auricle.
Sorry, people are waiting in the waiting room. Could you kindly admit them?
Oh, there's also that part.
Yes.
Sorry, okay. So admit all. Have admitted. Are they joining?
Yes, I think they've joined, yes.
Okay. For those that have just joined us, good afternoon. We haven't covered much, discussing the function and the anatomy of the ear. Whoever is playing music, please mute your mic. Okay, so function of the ear, it's responsible for hearing and equilibrium. So just when we say equilibrium, we're talking about maintaining balance. And this is our structure, which we'll go through. And we said it's made up of the outer ear, the middle ear, and the inner ear, okay? And on the outer ear, we mentioned that we have the pinna or the auricle. We also have the ear canal. In the middle ear, we have the tympanic membrane, which is our eardrum. We have the auditory ossicles, which are the auditory bones. We have 3 of them. We have the middle ear cavity, okay, and the eustachian tube. So when you say middle ear cavity, it's just the middle ear itself. It's an air fluid cavity that contains the inner portion of the tympanic membrane. It also has the eustachian tube or the auditory tube. It has also the auditory ossicles, which are 3 of them, namely the malleus, incus, and stapes. So moving on to our inner ear, we have the oval window, the round window, the cochlea, the semicircular canals. Okay, so the oval window and the round window are just part of the cochlea. We have the semicircular canals, which are these things we're seeing here. These are the semicircular canals. We have the cochlea, this snail-like shape. Sorry, let me just admit our friends. And as we go on further, we'll know which ones are which. So our outer ear mainly has, I wouldn't say 3 parts because some literature disputes this. So it has 2 main parts. The pinna, which I've talked about, this is a pinna. So it's a funnel-shaped like structure that is made up of elastic cartilage. That's the reason why you pinch. For those children who don't listen, they pinch. You pinch and it goes back to shape. This cartilage is elastic, okay? Its function is to collect sound and direct it to the ear canal. This is our ear canal here, the external auditory meatus. Can we please join on time? Okay. Okay. So this is our outer ear pinna. Remember we said the folded part is the helix. This is the antihelix. This is the concha. And then inside here, we enter our ear canal. The function of the pinna is like a funnel to collect everything so that it goes into the smaller portion of the funnel, which is our auditory meatus. It collects all sounds and put them in one place so that it is able to travel smoothly and elicit signals. And then the other part is what we call the ear canal, which is this portion here. Here it shows straight, but an ear canal it's an S-shaped tube about 2 to 2.5 centimeters long. Okay, in this tube, okay, sorry, we just join our friends, admit our friends. The ear canal is S-shaped. That's why when you're examining the ear of a child and adult, you have to be extra careful. This will help you be able to see it clearly. But how are we able to see it? During examination of the ear of an adult, you pull the ear, this helix, the pinna, you pull it outwards and upwards. What you're doing in an adult, when you pull it out and up, you are making this a shape, S shape, to be straight, so you can be able to visualize the eardrum and everything else. In a child, this S shape can be straightened by pulling the ear outward and downwards, okay? So you don't pinch, you pull gently. So that's our S-shaped ear canal. It's about 2.5 centimeters long. And then this ear canal has hair in it. It also has what we call the ceruminous glands. Their function is to produce earwax, okay? So one can ask, what's earwax? Earwax is just a constitution of sebum as well as dead epithelial cells. Remember, our ear canal is made up of epithelium, okay? And then this epithelium dies, it sloughs off just like skin. So when it dies together with the sebum, it produces what we call cerumen or wax. It's produced by these ceruminous glands in the ear canal. And its function is after the ear pinna here collects the sound, it directs it into this small neck of the funnel so that it projects on the eardrum. So its function is just to direct sound to the eardrum. Are we together? Our next portion of our outer ear.
Yes.
Okay, we discussed this already, our auricle. This is our auricle. Remember? I keep going through this because I know people are joining late so that we all are not left behind. We said this is the antihelix. This is the helix. This is the earlobe. Okay. The portion which is missing here is the tragus, okay, going into the ear canal like that. It helps collect all the waves that and then projects them into the eardrum. I mean, in the ear canal. The ear canal projects all the sound to the eardrum. Our ear canal or external acoustic meatus, these are just fancy terms, just means ear canal, where you put your matchsticks. Those of you who like to use matchsticks and earbuds, though that's a very bad habit. Please don't do that. Okay, so we have a sound wave as I'm speaking, it's coming to your ears, goes through the ear canal, it's collected here, it goes to the ear canal. From the ear canal, it goes to the eardrum. From the eardrum, it's able to be projected to the rest of the parts of the ear that we'll discuss later. So this is a temporal bone, the one you are seeing here, the temporal bone. We have the eardrum, this oval-shaped object. We also have the ossicles or the bones, these three, 1, 2, 3, which we'll discuss later, which makes up the middle ear. We also have this structure here, the inner ear. We have the cochlea, we have the semicircular canals, and we have our vestibular here. So we're done about the external ear canal. We are going to discuss or talk about our middle ear. Sorry, I'm admitting our friend. So the middle ear or the tympanic cavity, remember we mentioned that the middle ear, it has ossicles, it has a eustachian tube or the auditory tube. It also has a cavity. In itself, it's a cavity. So it's an air-filled space in the temporal bone, which contains 3 auditory ossicles and the eardrum. What are the names of our ossicles? We have the malleus or hammer. We have the incus, okay, or the anvil. We also have the stapes, okay? So these are Latin words that just means hammer, anvil, and stapes. Stapes is that thing you put on a horse when you want to ride. You put your feet so that you're anchored. It's shaped like that. That's why it's called the stapes. And then, other than that, we also have the oval window, which is the opening of a tympanic cavity that leads to our inner ear. And then in this same middle ear, we have what we call the auditory tube or eustachian tube. So our eustachian tube, it connects our middle ear to our nasal cavity or the nasal or the throat, okay? The nasal cavity is connected to our middle ear by the eustachian tube. So if you look at this eustachian tube in adults, it's well formed, it's longer, and it's slanted, okay? It's slanted, it doesn't come up, it's slanted just like it's showing on the diagram here. This is our eustachian tube. In children, it's shorter and it's horizontal, more of straight. That's why you find that children have a lot of otitis media and ear infections, should I say, frequently compared to adults because of a short and horizontal eustachian tube compared to that of adults. Another thing of note here is that this eustachian tube helps to balance out the pressure between on both sides of the eardrum as well as the middle ear. But remember this difference on size and projection in both children and adults. It is very important for mothers that when they are breastfeeding, they put the children at an angle to prevent backup of milk into the nasal cavity then going into the eustachian tube, causing infections. Always put your child at 45-degree angle when breastfeeding, okay? And then, okay, keep admitting, man. The tympanic membrane, our eardrum, which is part of the middle ear, this is a semi-transparent membrane. It is covered by a thin layer of skin on the outside. Also, it's covered by the thin epithelium on the outside. When I say outer part, it's on the tube, on the external acoustic meatus part, okay? From the outer ear, you come into the canal, and then you have the the outer portion of the tympanic membrane. And then on the inner part of the membrane, that's inside, on the side of the inner ear, you have what we call the cuboidal mucosa. It's what covers this tympanic membrane inside. And then it is cone-shaped. So when you look at a cone, where you are seeing here with your otoscope outside, you will see the oval shape of the cone. The apex of the cone, it's way inside in the inner ear, okay? So look at it as you're looking at the cone, but the cone is facing you. The outside is towards you, and the cone part, the pointy part, apex, is inside. So the eardrum, if you look at it with an otoscope, those of you that have seen, you see that it's something shaped like this. It's semi-transparent. You see some pink and redness. It's because of the epithelium. And that's why you find that when someone has been slapped, mostly by the police, they have blood coming out of the ear, or an accident, RTA, a person comes with bleeding from both ears, you have to know that it's either the eardrum is perforated or they're bleeding from the brain, okay? So when you look at it, you see this shape here, prominent pointy shape. This is a bone, this is a malleus, okay? This is our malleus. One of the three ossicles, the one we discussed, the malleus, the incus, and the stapes, the ossicle bones. This is our malleus. And then you see that it's like more like a demarcation. On the some portion, it's very relaxed. We call it the pars flaccid. It's made of loose areolar connective tissue. And then on the point where it seems a bit tense, the bigger portion, we call it the pars densa. It's made of dense irregular connective tissue. It's the most bigger portion of the eardrum. Its function is just to vibrate and transmit sound waves to the ossicles. So as I'm speaking, sound enters your ear through the ear canal. It goes and vibrates on the eardrum. As it vibrates here, the vibration will cause the hammer, which is our malleus, to vibrate, which will also in turn cause our incus, which is connected to the malleus, to vibrate. When the incus vibrates, it will cause the stapes, which it forms a junction with. The stapes, like the footplate of the stapes, is on the oval window of the inner ear. Those vibrations will reach the oval window, go into the inner ear, and cause a reaction for you to be able to hear. So these are our ossicles, okay? The malleus, the hammer, and the incus, these two are connected, which is an anvil, and the stapes. We remember I said that it's shaped like the place where you put your foot when you're riding a horse. So those of you who have ridden a horse before. So these are they are tiny ligaments that attach these to the ear, okay? The bones. We have the stapedias and the one that attaches the malleus also to the inner bone. Oh, I'm sure you've done all those things in physiology. For now, they are not all that important. So these are covered by our bones are covered by the mucous membrane, and then they form a bridge between the eardrum and the inner ear, okay? This is our eardrum here. Then we have the malleus, we have the incus, and the stapes here. Their function is to transmit vibrations between the eardrum and the inner ear. So the malleus is attached to the eardrum at a point called the tensor tympani. So you'll find that at the point where it forms tenseness here, where you can see the malleus here at this point, there's a muscle behind called the tensor tympani, okay? This muscle, what it does is that when you talk, the vibrations reach the eardrum. The tensor tympani will contract, pulling the eardrum inside. When it pulls it inside, the vibrations goes in, it will release it as well. Okay, so we have the tensor tympani there at the point where they attach. We have the tensor tympani, and this tensor tympani, it's innervated by the mandibular branch of the trigeminal nerve, the V3. It's not innervated by our vestibulocochlear nerve, it's by the mandibular branch or the V3 of the trigeminal nerve. So the eardrum vibrates, then the malleus, which causes the incus and the stapes to vibrate also in unison. They will do that, and then the footplate of the stapes will step on the over window, causing vibrations in the fluid. The over window goes into the inner ear, which contains fluid. Remember, our middle ear is air fluid space. Going into the inner ear, we have fluid involved. So vibrations also here will be transmitted through fluid, and you'll be able to hear, okay? And then we have the stapes where we said the footplate is attached to the over window. This helps, what does the ossicles do other than form a bridge between the inner and the middle ear? It also helps to amplify the force of vibrations from the eardrum. As I speak, it's just coming up normal. Then once it reaches here, it will be amplified by 22%, okay? Like 22 times the normal size of the sound that came through. So the over window vibrations move fluid in the inner ear to stimulate hearing receptors, which we'll discuss later when we start talking about hearing mostly. So what will happen is that the foot of the stapes will transmit these vibrations into the fluid in the inner ear, and the hair cells in there will cause action potentials to be generated. What will be next? Signals sent to the brain through the cochlea and the vestibular branches of vestibulocochlear nerve, and you'll be able to hear. So just remember, the function of the ossicles is to transmit vibration between the eardrum and the inner ear. They also help to amplify the sound that the eardrum projects to these bones. So your eustachian tube, we mentioned about the differences. I'll mention them again because they're quite important. So this is an infant, this is an adult. You can see here, our child's eustachian tube that connects the middle ear into the nasopharynx. It's quite horizontal. It's not slanted like our adult one. And it's also shorter, okay? That's why children have a lot of recurrent ear infections. So what it does is that it opens the middle ear to the back of the nasopharynx. At what point does it open? When you're yearning. That's why when you yearn like this, you find that there's a pop sound that you hear at the back of your head. That is the eustachian tube opening. Also, when you start chewing, it also opens to equalize pressure on both sides. Okay. And then, sorry, admit. Oh, okay. It also, its function is quite prominent for those who've boarded a plane before. There's usually discomfort when you're on a plane. You're always cleaning your ears, trying to open up. They feel blocked, but it's more of yearning mostly that helps it. And when you hear a pop sound, meaning the hearing has been restored or it has closed back to normal. Just remember the differences in size. That's what's important about eustachian tube and recurrent infections. I would like to mention that at the point where the eustachian tube joins the nasopharynx, we have a set of tonsils also. We call them the adenoids, okay? So these are adenoids. They're a site of nasopharyngeal cancers. You do that when I'm sure you did that during pathology. But just know there's a pair of tonsils there. We have one pair of tonsil under the tongue. We call them the lingual tonsil at the base, lingual tonsil. We have the palatine tonsils that we all know and see. Then we have these above the opening of the eustachian tube. We call them the adenoids. Our inner ear consists of the vestibular, the semicircular canal, and the cochlea. Okay. Also the round window. The round window, the spiral organ or organ of Corti. All these are on the cochlea. Okay, so just three things: the vestibular, the semicircular canals, and the cochlea. If you look here, this cone shaped like is what we call the cochlea. So it's like you get a pen and get a straw, you wrap around that pen with a straw and form a cone or a round thing. And then on top of your pen, that's the apex, which will be here. And then the rest of the straw that you have formed is our cochlea. Okay, so we have the cochlea, and from the cochlea you have nerve fibers that arise. We call them the cochlear nerve. And then we have where the cochlea joins the semicircular canals. This object here, we call it the vestibuli. The vestibuli or the labyrinth. The vestibuli has too many functions that we'll discuss when we start talking about equilibrium. It also has nerve fibers that arise and form what we call the vestibular nerves. So the vestibular plus the nerve fibers that are coming from the cochlea, which are innervated by the cochlear nerve, they will form what we call the vestibular cochlear nerve, okay, which is responsible for hearing. We'll discuss in detail as we go further in our consequent lectures. Today we are just discussing the structure. So you see here, this is the oval window where the stapes puts its foot plate. So sounds come in the eardrum, vibrations on the eardrum, they then transmit to the inner ear via the foot plate of the stapes. It will be here on the oval window where it's going now to stimulate fluid in this vestibular, and you'll be able to hear in this cochlea, and you'll be able to hear. From there, you have what we call the round window. The round window is somewhere here, as we'll discuss on the beta diagram. This is just showing the overview. Okay, we have the ampulla these are more like doors or reservoirs where the fluid in the semicircular canal comes to join the vestibular. Okay, so we have the vestibular, we have the cochlea, we have the semicircular canals. These semicircular canals, there are three. You have one that projects upwards, we call it the anterior semicircular canal. We also have the lateral that points towards you, it's a lateral semicircular canal. We also have the posterior that points towards the back. We call it the posterior semicircular canal. So this is what we're talking about. We have the cochlea here. We have the oval window. At the base of the cochlea, we have the round window. Okay, so you look at it as how do I explain in simple terms? Okay, I don't want to confuse you much. We'll discuss later in the consequence lectures. It's quite tricky to understand, but very easy actually. So just remember the cochlea, the vestibular, and the semicircular canals is what makes up the inner ear. Okay, and which one is this? We say this is our anterior semicircular canal. We have the posterior semicircular canal, and the one that projects towards you, the lateral semicircular canal. I mean the lateral semicircular canal. And then our semicircular canal. So these are part of the labyrinth. When I say labyrinth, please do not be confused. This has to do with the fluid that is contained in this inner ear, okay? They provide the sense of equilibrium. For example, here mentioned is a dynamic equilibrium. What I'm talking about is when I stand and start spinning, what helps me not fall down? It's the semicircular canal. There is a part in the semicircular canal that we call the Cristia ampullaris, which we'll discuss later. So the semicircular canal is responsible for dynamic equilibrium when you're spinning or when you're moving your head side to side rhythmically. And then we have also the cochlea, which is this portion here, the snail-like portion. The cochlea's function is hearing. So it has a bony core and a thin bony shelf that winds round the core like a thread on a screw. Remember I said you have a pen and a straw and you wrap it around your pen. That's how it looks like. So the shelf divides the osseous labyrinth of the cochlea into upper and lower compartments. So this just means that when you unroll this this shell, when you unroll it, you will have a structure like this. Okay.
Excuse me, Doc. The meeting will be ending in a minute. So when it ends, just rejoin using the same link and password.
Okay.
Yes.
I'm just trying to find something I can use to draw. The scala tympani and the scala vestibuli, they contain fluid. What fluid? The perilymph in blue. And then the scala media or the cochlear duct, together with all these bodies in the semicircular and the vestibuli, they contain perilymph, which is similar to the CSF fluid. So as we continue looking at our cochlea, we have a round window here, and then we also have the oval window. So the round window is found in the scala tympani. The oval window, we have it here at the beginning of our cochlea. So the cochlear duct or the scala media, which is this one that separates the tympani and the vestibuli, this one, where the kesa is. So it's part of the... Hello?
Kindly admit some people.
Yeah, I'm sure they missed out. Anyway, this is just anatomy. When I would like us, when we start discussing the semicircular canals in depth, or when we start talking about hearing and balance, please let's be on time, mind, because we spent large portion of this lecture just admitting people. I know we are busy, so you communicate with your class rep a time which is good for every one of us. So the cochlear duct, this one, containing what? Containing indolence. It is part of the membranous labyrinth. When we say membranous, we just mean it contains indolence. It lies between two bony compartments and ends at a closed sac at the apex. So this means that these two, the endolymph and the perilymph, they do not meet at all. They don't mix. So they are separated. This duct separates the scala vestibuli by what we call the racina membrane. Okay. What they mean is between this upper part of the vestibuli and our scala and our cochlear duct, we have a membrane in between two, where my pencil is. We have a membrane called the racina membrane. Then between the lower parts, the tympani and the cochlear duct, we also have a membrane. We call it the basilar membrane. So we have the racina membrane separating the tympani from the cochlear duct. And we have a basilar membrane separating the cochlear duct from the tympani. Above the basilar membrane is what we call the organ of Scotty, which is responsible for hearing. So when we zoom in here, which we'll do in our next lecture, you have an organ of hearing. We call it the organ of Scotty. Okay, so this has come to the end of our lecture, but I would like to go through something with those that have just joined. Okay, we said our inner ear consists of the cochlea, semicircular canal, and the vestibular. And our semicircular canal, we said our semicircular canal contains is made up of two parts: the bony labyrinth. We have the bony labyrinth and the membranous labyrinth that makes our cochlea. When we say bony and membranous, we just mean what is contained in them, what type of fluid. In the bony labyrinth, we have the perilymph. In the membranous, we have the endolymph. And the difference between these fluids in the inner ear is that the endolymph is rich in potassium, the perilymph is lower potassium, and it's the same like the cerebrospinal fluid. Our cochlea here has two parts. It's like you are putting up a line in between these circular, semicircular. Above, we have the. I can't seem to find anything to use to draw, so I can make it clear. Anyway, so when you unravel this, we said visualize it as a pen you're holding. Above the pen, you have the scala tympani, separated by the scala media from, we have the scala vestibula separated by scala media from the scala tympani, okay? And between the scala tympani and the scala media, the lower portion, you have the basilar membrane. Between the scala vestibuli and the scala media, you have a racina membrane, okay? So this is just an overview. In your own time, kindly go through the anatomy before we do hearing as well as equilibrium. Remember, the main thing is that the cochlea is responsible for hearing, and it makes the inner part. The inner part of the ear is semicircular canal, cochlea, as well as the vestibuli. And in this, we mentioned the round window in the inner ear because it's part of the cochlea. The external acoustic meatus, our eardrum, our ear canal, makes up the outer ear. And our middle ear, we have the eustachian tube, which is very important, and the ossicles, the three ossicles. Okay, so this is the outer ear. This is our inner ear, and this is the inner ear. Sorry, the middle ear, and our outer ear. Are there any questions so far? Hello? Do you have any questions? Any questions at all? Do we have any questions? Hello? Are we together?
Yes, ma'am.
Do you have any questions? I did not want to bring in any cellular type of anatomy in this lecture because it will just confuse you. In your own time, I know you understand the outer ear, the middle ear. I wanted to look at the inner ear in your own spare time, okay? Focus more on this. Find ways in which you can understand it, those who haven't understood and those who keeps joining late. Remember cochlear, semicircular canal, and vestibular. Then here in our next lecture that we meet, we'll digest this a little bit more on the cellular level, where we'll talk about the hair cells, we'll talk about the ampule, we'll talk about the circuli, and yeah, so forth and so on. So I want you to go and read through so that as we are discussing, you are also able to participate, okay, or go along with me. If there are no any other questions, this is where we end, okay? And as you go, I want you to remember the difference between the eustachian tube in adults and children. Thank you. Thank you so much.
Thank you.
Have a great day.
Thank you.
Okay,
You too.
bye.
Have a nice day.